Yo guys, this is Donvin. So in today's video, I'll be focusing on Cholera. What is Cholera? Well, Cholera, this is an acute infectious diarrheal disease affecting the small intestines, and it's caused by a bacteria called Vibrio cholerae, characterized by projectile vomiting, profuse diarrhea, and passage of rice water stew. Cholera is a highly contagious and infectious waterborne disease. Its mode of transmission is fecal-oral route. The incubation period for cholera happens to be few hours to 5 days for the condition to present itself. Remember, incubation period is just a time or a period from when the contact of the infection up to the first presentation of the sign and symptom. Fecal-oral route, this is just the ingestion of any substance by mouth or through the mouth. Now, the predisposing factors or the risk factors to cholera includes drinking of contaminated water, eating contaminated food, poor sanitation, poor hand hygiene, and eating undercooked food. A patient infected with cholera will present with the following. They are going to have a projectile vomiting, a profuse diarrhea, passage of rice water stew, muscle cramps, muscle weakness, a fever, dehydration, just to mention a few. Now, is cholera preventable? Can we prevent cholera? Well, yes, cholera is highly preventable. Inasmuch it is communicable and infectious, we can prevent and reduce the chances of having cholera. We have to ensure that we treat our drinking water by ensuring that the water is boiled or chlorinated. 1. Number 2, having a good sanitation. Sanitation is very important in the prevention of cholera. The sanitation I'm talking about includes excreta management, solid waste management, waste water management, and drainage system management. If this is well managed, the chances of having cholera will be well reduced. The third one, washing our hands. Hand washing remains one of the very important ways to practice good hand hygiene. Remember, the mode of transmission for cholera is through fecal-oral route. So if we practice a good hand hygiene, we reduce the chances of having to suffer from cholera. The fourth one is washing of fruits and vegetables before consumption. Well, fruits and vegetables are a risk of having cholera. Remember, we do not know how the vegetables are being grown. For them to grow all healthy, mostly they use excreta drainage waste as manure in order to ensure that these vegetables, they grow very, very healthy. So if we claim to start eating salads, an example, without properly washing those vegetables, we actually going to ingest or consume the microorganism, hence going to cause cholera. So the best way in the prevention of cholera is by ensuring we wash our fruits and vegetables before consumption. And the fifth one is eating well prepared and cooked food. Ensuring that the food we eat is well prepared and well cooked. An example, we need to ensure that if we have some leftovers, those leftovers have to be covered. And when needed for consumption, we need to ensure that we warm our food. This is going to help in killing the microorganism. So this practice helps to reduce chances of having cholera. If you happen to pass loose water stew more than 3 times in 24 hours, kindly visit your health care center for proper services. It could be a diarrheal disease or maybe gastroenteritis. So whatever the case, visit your nearest health care center. Remember, cholera is a serious life-threatening condition. You can die instant if management or treatment is not given to you. Now, let's medically diagnose and treat cholera. The following are the investigations that are going to help us to come up with a diagnosis for cholera. The medical management aims to correct fluid and electrolyte imbalance, to eliminate the causative organism, to prevent the spread of infection, and prevent the complications. Investigations and diagnosis. Number 1, history taken. Number 2, physical examination. On physical examination, this can either be subjective or objective data. So write what you can see on the patient. Are you seeing the patient projectile vomiting, or profuse diarrhea, or passage of rice water stool, or they have a fever? The third investigation is stool for culture and sensitivity, rectal swabbing, sigmoidoscopy, vomiters for culture, and a full blood count. Those are some of the investigations that can help us to come up with a diagnosis for cholera. Now, let's talk about the treatment. How is cholera treated? The treatment of cholera, since there is severe dehydration, our first line choice of treatment is the use of Plan C. We are going to administer fluids, and the first fluid of choice is Linger's lactate, followed by normal saline and dextrose. If the patient can drink or can tolerate oral fluids, we can encourage intake of ORS, oral rehydration solution. Note that the fluid management of the patient, we need to ensure that these fluids are administered 30 ml per kg body weight in the first 30 minutes, then 70 ml per kg body weight in the next 2.5 hours. This is how you're going to attend your treatment. For the medication, we can administer antibiotics such as doxycycline, cotrimoxazole, and ciprofloxacin. We can even give an antipyretic stroke analgesia, which is paracetamol. Not forgetting antihistamine like promethazine to treat the nausea and vomiting. Of course, not forgetting zinc sulfate. This marks the end of cholera tutorial. If you want to learn more about the management in nursing, kindly feel free to join our tuitions platform on the number showing on your screen. Thank you for watching.